Let's now look at how Health Home's quality measures data will be reported by giving a brief overview of MACPRO and the state roles for quality measures. We previously discussed this in depth during the MACPRO state roles training, so if you attended that presentation, the next few slides will be a refresher for you. I also want to point out that what I'm going through now, if you've attended one of our trainings last week, will be the same. There will be some differences when we're in the system, but mostly it will be very similar. MACPRO is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives, such as quality measurement reporting and state plan amendments. For some applications, MACPRO will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of quality measurement reporting, MACPRO replaces the CARTS reporting for adult core set reporting and Section 2A of the Child CARTS report. Additionally, Health Home's core set reporting will be reported for the first time using MACPRO. MACPRO is also the system for reporting under the Maternal and Infant Health Initiative developmental measures. MACPRO is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both the CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPRO supports data-driven decision-making for Medicaid and CHIP programs. A number of distinct roles have been established for states within MACPRO. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPRO differ from those that are used in CMS's other web-based systems, and in some applications, this is the first time that there are roles. This slide lists the 4 quality measures roles for state users. The state editor is responsible for building a quality measure report. The state point of contact, also known as the SPOC, is responsible for reviewing and editing a quality measure report. The state director conducts the final review of quality measure reports, certifies the report, and submits the report to CMS. And the state system administrator, also known as the state admin, is an administrative role that approves and modifies state user roles. I would like to note that in the initial release, the range of the state admin's activities may be limited. However, it will expand over time. A state user may have more than one role in MACPRO, with the exception of the state system administrator. With this release, individuals with the state system administrator role can only hold that role. It is important to note that all state roles must be filled for proper workflow functionality. Additionally, if you requested more than one state role, you will only have one user ID with the roles you are authorized included. So let's begin by reviewing the state workflow for creating, reviewing, and submitting quality measure reports. Here is a brief overview of the State Health Home's quality measures reporting submission workflow. First, the state editor logs into MACPRO, enters the necessary information, and submits the report to the state point of contact for review. Then, the state point of contact, or SPOC, reviews the report. Assuming the SPOC is satisfied with the report and does not wish for the state editor to make detailed edits, the SPOC forwards the report to the state director to review. If the state director agrees with the information, they will certify and submit the report to CMS. If the state director would like changes to be made, they may return the report to the SPOC for further work by denying certification. Here is a more detailed workflow showing the steps to create, review, and submit a Health Home's quality measure report. We will walk through this process in the system starting with the state editor, so don't be overwhelmed by the detail, and we will go through it step by step. So let's now move into the MACPRO training environment to begin. Please note that because this is a training environment, you may notice slight cosmetic differences between this demonstration and what you see when you go into MACPRO to submit your quality measures. So we're going to get started by logging into MACPRO as a state editor. The information you see during this training is arbitrary and only being used for training purposes. When your state enters your Health Homes Core Set quality measure information, you should follow the technical specifications for each measure. Additionally, although we are using the state of New York, this is not a reflection of their quality measure information in any way. So when you first log into MacPro, you are taken to your news page. This page operates similarly to a social media platform. You can write a post for your team, send a message to a team member, send a task to an individual, or recognize someone by providing them kudos from the text box located at the top of the page. The Actions page, so to begin, Health Homes Quality Measure Core Set Reporting, first go to the Actions tab. This is located on the toolbar at the top of the page. The Actions page is where MacPro users have the opportunity to perform several actions, including creating an Adult Quality Measure Report, creating a Health Homes Quality Measure Report, a Maternal and Infant Health Quality Measure Report, or a Medicaid and CHIP Child Quality Measure Report. The state editor also has the option to delete an annual report, generate a MacPro report, request a MacPro role, or view the implementation guides. There are two options for viewing the implementation guides, and you'll notice in the gray text directly below that the guides are separated by a section for all submission types and an option for quality measures only. Because we are in the training environment, we have the ability to create reports within several authorities. This screen may vary when you log into MacPro depending on the authorities you indicated within the role request template. So for the purpose of this demonstration, we will create a Health Homes Quality Measure Report, and the steps we will go through generally apply to all types of quality measure reports with a few minor exceptions, and there are demonstrations that walk through how to create the other quality measure reports as part of MacPro training. The trainings are also recorded for your future reference. So we're going to get started by selecting Create Health Homes Quality Measure Report. This takes us to the Health Homes Quality Measure Report admin page. As you see, there is a drop-down option at the top of the page to select the federal fiscal year you'll be reporting. Currently, you can only report in federal fiscal year 2013, so that's an easy first step. And there are several core measures listed in the Not Started status. Additionally, there are utilization measures listed below the core measures. We first determined which federal fiscal year we would be reporting on, and we've already clicked that. That is for fiscal year 2013. Next is a brief disclaimer describing health homes and quality measure reporting. Be sure to read this before proceeding. It lets us know that health homes provision, authorized by Section 2703 of the Affordable Care Act, provides an opportunity to build a person-centered care delivery model that focuses on improving outcomes and disease management for beneficiaries with chronic conditions. The Health Homes Core Set of quality measures will be used to evaluate care across all state health home programs. Specifically, Section 2703 requires health homes providers to report health care quality measures in order to receive payment. The recommended Health Homes Core Set will require reporting at the health homes provider level, which the state will collect and aggregate at the health homes program level. So now that we've read this disclaimer, we're going to choose the state plan amendment associated with this report. And we're going to click the drop down, and we're going to select the New York Health Homes SPA with the SPA ID New York 1210. At this point, I want to pause to point out some links that may be helpful during this process that are located on the upper right side of this page. First is the Request Technical Assistance link. This link will allow you to submit a TA request to the CMS Medicaid and CHIP Quality Measures Technical Assistance and Analytic Support Program mailbox. This link should be used for questions related to the report content, such as how to develop state rates based on data from multiple data sources, or questions about the measure technical specifications. Questions related to using the system should be directed towards the MacPro Help Desk. We will go over how to contact the MacPro Help Desk at the end of this demonstration. Now let's go through the process of requesting technical assistance. We will begin by selecting the Request Technical Assistance button. Indicate that yes, you have a technical assistance request for the current year. Compose your question in the text boxes provided. It will be sent as if it is from your email box, which is the email included in your user profile. Please note these messages go to the Mac Quality TA inbox. You may CC your colleagues using the carbon copy line. For this demo, we will CC the MacPro Help Desk as an example at macpro_helpdesk@cms.hhs.gov. If you wish, you may enter multiple email addresses into the CC field. You'll need to separate the email addresses using a comma like you would in any other email system. In the subject line, we're going to enter a training TA request. You would treat this like any other email message. We're putting training TA request for this demonstration. Then in the message box, we will include a brief message indicating our question for training purposes. Note that there is a 4,000 character limit, and you may track your character usage in gray at the bottom left of the text box in the character count. And we've used 35 out of 4,000 characters with our message. This is for training purposes only. Next, indicate whether or not you want technical assistance with reporting this measure in a future year. We're going to indicate no, we do not want technical assistance with reporting this measure in a future year. And now that our TA request is filled out, we're going to submit by selecting Send Request on the right side of the screen. You will receive an automatic response from the Medicaid and CHIP Quality Measure Technical Support and Analytics Support Program mailbox immediately following the submission of your request. Here's an example of what that message looks like. The Quality Measures TA team will respond to your request within 5 business days. Again, as a reminder, only submit technical assistance requests through this avenue if they are related to measure content. All questions related to how to use MacPro should be directed towards the MacPro Help Desk, which we will review in more detail at the end of this demonstration. The second link I'd like to draw your attention to is the View Implementation Guide link. By selecting this, you may download a PDF version of the implementation guide for your reference. And the implementation guides are documents that provide specific information on how to complete and review a specific section of MacPro. So next we must provide responses to the administrative questions and cost data section by selecting here. You can see it's right there above the core measures. You cannot start reporting on your measures until you complete the administrative questions and cost data section. So first indicate the total number of individuals in the Health Homes program. In this case, we're going to enter 12,000. You're going to notice that we originally put a comma into our 12,000, but once we clicked out of the text box, the comma was removed, just automatically updating our information into the MacPro standard format. Next, we're going to indicate the total annual number of adults and children. Adults are going to be 5,000 and children will be 7,000. These two numbers must add up to the total number of individuals in the Health Homes program. If they do not, you will receive a warning message. Then enter the number of Health Homes providers operating under the Health Homes program. In this case, we're going to enter 1,000. And next, we're asked to provide the amount of cost savings for calendar year 2012. We're going to enter 2 million. The numbers we're entering are not a reflection of New York, but are simply arbitrary numbers being used for training purposes. You should be sure to follow all technical specifications when you complete this information. And finally, we're going to describe the cost savings methodology. We're going to enter just some standard dummy text information here. If you'd like to provide further information in relation to the cost or administrative data, you may do so by uploading a document in the provided area. We will review how to upload a document later in the training. So now let's return to the admin page by scrolling to the top of the page and selecting here in blue with the View Admin screen here. This will save our data entries. I point this out because typically we encourage you to save your data prior to moving to a new page. But since there is not an option on that page to do so, moving to the next page by clicking that Here button will do so. Let's begin by selecting 2 core measures and a utilization measure to report on. You may select multiple measures at once, so we're going to select Adult Body Mass Index, or ABA, Manage Health Home Specific Goals and Measures at the bottom, and Ambulatory Care Emergency Department Visits within the utilization measures. Once we select the measures we'll be reporting on, scroll to the bottom of the page and select Begin Reporting. Fill out the information for the first measure. In this case, Adult Body Mass Index Assessment. We're going to scroll up a little bit so we can see the top of the page. This page is dynamic and more questions will appear as we go along depending on our selections. First, select Yes, we are reporting on this measure. The first section is Measurement Specification. Select the small plus or minus sign to the right of the section to expand the field. Each section will require us to expand the field to provide our answer. In order to avoid extra clicking, let's select View All Responses at the top of the page to expand all sections. Now returning to the measurement specification, we're asked if we're using NCQA or other, and for this training we're going to choose NCQA. This selection prompts us to specify the version of HEDIS used, and we're going to select 2012. As we saw here and as I mentioned before, the pages in MacPro are dynamic and more questions will appear as we go along depending on our selections. Next is the Data Source section. Check off Hybrid, Administrative, and Medical Records Data. This prompts the system to ask some more questions. So indicate that the administrative data are coming from MMIS, or the Medicaid Management Information System, and the medical records data are coming from both EHR and paper. In the Data Source section, you will notice that the questions have a combination of checkboxes and radio buttons. Please note that you can select more than one checkbox, as you can see with the MMIS selection. However, when there are radio buttons, you must only select one option, as you can see with our selection of both EHR and paper. So next is the Date Range section. All measures reported need to have start and end date periods for the measurement period, and as Mathematica indicated, and as the directions also note, the measurement period entered should not include the look-back period. For this training, we're going to use July 2012 as the start date and July 2013 as the end date. And again, this is just arbitrary information used for the training purposes. If at some point while you are filling out your report you want to return to the admin screen, you can do so by going to the bottom of our current page and selecting Save. Make sure that you select this so that all of your information is saved. The system does not automatically save your entries at this time. Also, please note that clicking Save will take you to the top of the page and minimize all of your open sections. However, as you see, by expanding some of these fields, our entries are still in place. We can now return to the 2013 Health Homes Quality Measure admin screen by selecting Go to Admin Screen at the bottom of the page. Once we're back here, we can see that our Adult Body Mass Index assessment is in progress because we began filling in the information required, but we did not complete the information or validate our questions or our responses to the questions. Therefore, it is not in the complete status yet. So let's reselect our core measures, which would be the Adult Body Mass Index assessment, the Manage Health Home State-Specific Goals, and our one utilization measure, which is the ambulatory care measure. And then let's get back to our reporting. So this will take us back to if you go to the top of the screen here, you can see that we're back at the ABA measure, and if we hit View All Responses, we can go back to where we were. So we're going to go back to definition of population included in the measure to continue filling out this report. And we're going to define the denominator. As you can see in the directions, we must select all that apply. So we're going to select denominator includes Medicaid population. Next, we're going to indicate that yes, the denominator does represent your total measure eligible population as defined by the technical specifications for this measure. And then it's the performance measure section. And this section includes several text boxes. Make note that there is a 2,000 character limit. This character count is tracked for you in gray at the bottom of the box. Check off the 18 to 64 age range and include the numerator, denominator, and rate. For the numerator, we're going to enter 1,000. The denominator is going to be 3,000. And our rate is going to be 33.33. The system indicates that the entry will not be accepted by outlining the rate box in red. And when we hover our mouse over this, we see that the value must be numeric with one decimal only. So we're going to change our value to 33.3 to make this an acceptable entry. If we had indicated that we were using administrative data only, the rate would auto-calculate for us. But because we indicated hybrid, we're able to we're able to manually enter our rate information. If you do not select an age range, the corresponding text box explaining why the data is not entered is a required field. This is indicated by the red asterisk located at the end of the text describing the text field. All required fields throughout the report have a red asterisk, so I encourage you to use this as a guide while completing the information. Since we're not checking off the box for the 65 to 74 age range or age range total, we're going to include some text explaining why the data was not entered. And again, we're just going to put in some dummy information here for training purposes only. So we're going to do the same thing for age range total. And you'll see that below there, we also have a text box for additional notes and comments on the measure. We're going to skip this for today's training as it's just an optional field with some more, it's an opportunity to provide some more information. So now let's continue to the deviations from measurement specification section. There is only one question. Did your calculation of the measure deviate from the measure specification in any way? Indicate no, our calculation of the measure did not deviate from the measure specification in any way. So the next two sections are optional. Note that there is not a red asterisk in these areas. The first section is the optional measure stratification. As the title suggests, it is also an optional field. And we're going to include optional measure stratification for geography. We have the option of selecting urban, rural, or adding an additional geographical region. So let's select rural. Automatically, we are offered the option of reporting on 2 age ranges. We also have the option of creating an additional or alternative classification or subcategory. We will enter information for both age ranges. The numerators will be 1,000. The denominators will be 10,000. And the rates will be 10. Then let's select the blue link below of the table to add an additional or alternative classification or subcategory. Then our alternative classification will be age range 18 through 25. Our numerator will be 100. And our denominator will be 1,000. Then our rate will be 10. Next, let's add an additional geographical region by selecting the blue link below the table named Additional Geographical Regions. We can define the geographical location as suburban. And when we click out of the text box, the next section is going to appear. If at some point you think there should be another section, click out of the text box and the system should catch up to you. And we're going to report on both age range 18 through 64 and 65 through 74. Our numerators for both are going to be 1,000. Our denominators for both are going to be 10,000. And our rates will be 10. Again, these are arbitrary numbers being used for training purposes only. When you go through and complete this report, please be sure to follow all technical specifications. The next optional section is for any final comments. And we're going to skip this for this training. And the last question within the core set measures if we would like to validate the core measure data at this time. The measure does not need to be validated at this time to proceed, but it must be validated for the measure to be marked as complete. All core set measures must be complete to submit the report to CMS. So for this training, we will select yes, validate the core measure data at this time. And now that yes is selected, there is a note below indicating that if validation fails, errors will appear in red above. Validation ensures that information is fully filled out within the report. If there is a field that is missing the required information, the system will indicate what information is required in red prior to allowing you to complete the core set measure. If at this time you are not ready to complete the report, you have the option not to validate the measure. This core measure will be noted as in progress on the admin page until you validate the report and it is completely filled out. So let's now move on to the next measure by selecting Go to Next Measure at the bottom of the page. Since there were no error messages, we were able to continue to the Ambulatory Care Emergency Department measure, also known as AMB. We are not reporting on this measure, so let's begin by selecting No. Next, there are a series of checkboxes presented for you to explain why you are not reporting on this measure. Remember, if you're choosing not to report on a measure, you need to select No and indicate why. And we're going to select Service Not Covered. And next is a section where you can add documents to the report. And we will do this at the end prior to submitting for review. However, you do have the option to upload documents to the report from each measure. And now that we've completed this, we're going to select Yes, we would like to validate the core measure data at this time. And we're going to select Go to Next Measure. Since there were no error messages, we were able to continue to the Manage Health Homes, State-Specific Goals and Measure page. This measure is set up slightly differently than the others, so let's see what we have going on here. We see within the goals directions that in addition to the CMS recommended core and utilization measures, identify goals and define the measure the state will use to assess the health home's model of service delivery. For this training, we will create one goal and one measure. So we're going to begin by selecting Add Goal. And we're going to name our goal, because we're very creative, we're going to name it Training Goal. And our description will be, this is an example for training. If you want to modify the goal after you've done this, you will be able to do so. We're going to click Save. And this adds the goal into the goals table above. If you want to modify the goal, you may do so in the text boxes below, as you can see. You'll just have to click Save again. And you may define up to 5 core measures, but for this training, we're going to define 1, and we're going to do so by selecting Add Measure. This takes us to the state-specific measures page, and we're going to expand the 3 sections included by selecting View All Responses. Remember, we don't like clicking through, so we're doing that to speed things up. And first, we'll provide the measure details. We'll name the measure Training Measure. Because again, we're very creative. And we will describe the measure as just a measure created for training example. We're just putting in some text here to keep things moving. Below is the performance measure section. And we're asked to describe the methodology used. And again, we're just going to put in some dummy text here. Then we will indicate the measure applies to all ages. And this prompts us to provide a numerator, denominator, and rate. The numerator will be 1,000, the denominator will be 10,000, and the rate will be 10. Now that our measure information is entered, we're going to scroll to the bottom of the page to validate the measure. We'll hit Select Yes, and then select Save. Then we're going to scroll to the bottom of the page and select Go to State-Specific Section. This returns us to the state-specific goals and measures page and our newly created measures listed in the related measures table. Now that we entered a goal and a corresponding measure, we're going to continue by selecting Go to Admin Screen, since this was the last of the measures that we selected. As you can see on the screen, the status of the ABA, AMB, and Health Home's state-specific goals and measure core measures are now incomplete. You'll see the status says complete, and there is a circular green image with a checkbox in the center. In order to submit the 2013 report to the State Point of Contact, or SPOC, the state editor must complete the information for each core measure like we did for the ABA measure, either indicating your state is reporting on the measure with all accompanying information, or that your state is not reporting on the measure and why. To be efficient with our time during this demonstration, we created a Health Homes Quality Measure report with all measures completed for us to submit to the SPOC for review. So to access reports that you are in the process of working on, go to the Records tab on the upper toolbar. Select Health Homes Quality Measures. Then we will choose the report we created earlier today. As you can see, the report we created about a minute ago is listed at the top. But we're going to be using the report ending in 046. The package ID consists of the state or territory abbreviation for the report, the year, the type of report, in this case Health Homes Quality Measures or HQM, and a MacPro generated number. I do want to point out that we saw several packages or reports listed in the Records tab, but that's simply because this is the training environment. You will not be expecting to see that many reports in your Records tab. So if you select the link to the report, which we've already done, it will take you to the report summary page, which includes a timeline indicating the stage in the process the report is in. And you know what? It looks like we picked the wrong one. So we're going to go back to Records. And you know what? We meant to hit 045. That was my mistake. We're going to go down here. And this looks much better. You see in the timeline that we're at the created spot, which is where we need to be here. There's also a report information section, an SPOC, which I'll remind you is a state point of contact information section, and an audit information section. You'll notice on the left side of the page, you also have the option to view news related to this report, related actions, report data, and a consolidated view. If there were multiple versions of the report, you would view older versions of the report here as well. To continue modifying this report, select the Modify Health Homes Quality Measure button in the top right corner. As you can see, this takes us to the Health Homes Quality Measures 2013 report, and all of the core measures are in the complete status. And one utilization measure is complete. Again, this is something we created ahead of time to stay efficient with our training. Next, you may upload accompanying report documents. This is something we could have been doing throughout the report on each measure page, or it also can be completed from this admin screen. Regardless, the documents are associated with the report in general and are not associated with specific measures. You can upload a maximum of 84 documents to a report and a maximum file size of 2 megabytes. You may upload PDFs, PowerPoints, Word documents, and/or Excel spreadsheets, We will upload a PDF document for this training. So first we're going to select Browse. And then we're going to go to my desktop, go to the demo attachments. We're going to select our test document. This is the blank PDF we're using for training purposes. We're going to put in a quick description here. You need to put in a description, and this is going to allow you to see a little bit more detail about what you've uploaded in the table above. And once it's complete, you're going to hit Save Documents. Now you might be taken to this page. It says Save in Progress. And we're just going to hit refresh to take us back to the admin page. If you run into trouble there, it's taking a long time, feel free to reach out to the MacPro help desk. So now our test document is included. If we were to have uploaded 2 documents, we would have been able to sort the documents. So if you have multiple there, you can sort documents by selecting the column header, and a red arrow will appear to indicate the column header the documents are being sorted by, as well as whether they are being sorted by ascending or descending order. And you can see that our description is included in the table, and this provides a little bit more information about the document we uploaded beyond the document file name. And if at some point you want to delete a file, you may check the box next to the file and select Delete Document. For this training, we're not going to delete documents. We just want to make sure you know what that process would be if you uploaded the incorrect form. At this point, we are ready to request the state point of contact review. So we're going to select Request State POC Review at the bottom of the page. Now this takes us to the record summary dashboard for this report. And as you can see on the timeline, the report is now in review. Additionally, there is no longer an option to modify your report in the upper right corner like there was previously. The state point of contact received a notification in their email inbox and a task in MacPro indicating that their review was requested for this report. You will not be able to edit this report as the state editor again unless the state point of contact returns the report to you. So now let's return to the PowerPoint to review what we have done thus far and what the next steps are. So if we review the steps we just covered, you will see that in the first row, we're focusing on the state editor row, We logged into Mac Pro as the state editor. We selected the Actions tab along the top bar, then clicked the Create option for Health Home's Core Set Quality Measure reporting. Next, we selected the fiscal year of interest, the core measures we would report on, and we began filling out the needed information. When we finished entering the information we needed, we chose to validate our information. To expedite the training, we then moved to a complete report rather than selecting additional measures. And when everything was reviewed, when everything was entered, we selected Request SPOC Review to complete the process. So at this point, I'm going to pause for a few minutes to answer any questions. Janita, can you please open the line for Q&A?